An incidental nodule is basically any kind of abnormal growth in the lung that's found for reasons other than screening. These are patients who might come into the emergency department and have chest pain and get a CT scan and we find a growth. The point is that we find it and then we identify those patients and try to determine what's the risk of having cancer. And we can do that various ways.
As we've built out our thoracic oncology program in Chattanooga, we've noticed that it's a collaborative effort trying to figure out the most efficient way to move a patient through the system. When we're assessing a lung nodule, one of the important things, we don't have a lot of tools in terms of determining whether or not that patient needs to be biopsied or not. So when we're looking at lung nodules, we want to utilize all the tests that we have available and all of the tools that we can utilize to be able to assess whether or not a lung nodule needs to be biopsied or not. So rather than looking at a chart or looking at the size of the lung nodule or using a calculator, we can actually test the patient's blood to see if it's appropriate to do a biopsy. And that's revolutionary.
I think the Nodify XL2 test can potentially revolutionize how we manage indeterminate pulmonary nodules, in the sense that it's going to give us another tool we can use in these patients that have indeterminate pulmonary nodules that are really on the smaller end of being able to biopsy accurately. There was a large multi-center study that helped validate this test that looked at its use in patients who have indeterminate pulmonary nodules with a risk factor of 50% or less for having cancer.
The test really helps us to stratify these large number of patients that come in with nodules and help us assess which ones need an intervention sooner and which ones maybe can go into watchful waiting. Combining that pre-risk assessment of the Mayo calculator with the proteomic assessment of that patient's own blood, then we can really offer a next level of risk stratification for this patient and hopefully rule out disease.
We can spare that patient a needless invasive test, and that's important.
When we have some actual data that's backed up by science, that adds a significant level of confidence both for us and for those patients. It's hard for us to understand what that's like for patients to go home every night and wonder, do I have cancer? So this adds a little bit of confidence for them. The promise that Nodify XL2 offers us is being able to do a blood test and potentially avoid unnecessary procedures in patients that may have benign disease.